I'm joined by Dr. Arun Nagarajan with Cleveland Clinic Foundation, and the topic that we're going to be discussing is rectal cancer. Thank you so much for being here, and thank you for visiting us here in the Cayman Islands and bringing your expertise to the people.
I appreciate the opportunity. It's fantastic to be here. Wonderful island. I've been on a ship before, but not on an island before.
So now you're getting the full Cayman experience.
I'm just going to walk around and explore. I plan to walk to the mall in the evening.
Oh, good.
It's a beautiful area.
Yeah. Well, we're really glad to have you here. And as you know, when you're in an island in the Caribbean, we don't always have access to this type of expertise.
Right.
So I think we're grateful for this and for the symposium and the information you're able to share both with the healthcare experts and with the community. So I mentioned we're discussing rectal cancer. Can you tell us a little bit about, because I think there might be, sometimes you hear the term colorectal cancer, or can you just kind of describe the differences between these?
Yeah, I think that's a very good, important question. So when you look at the bottom of the opening, that's the anal canal, which is about 4 centimeters. And from 4 centimeters onwards, upwards to about 15 centimeters, the rectum. It's really important. The anal canal is squamous cancer. But the rectal cancer is adenocarcinoma. There's some interchangeability, but for the most part, squamous anal and rectum is adenocarcinoma from the 4 centimeter to 15 centimeter. And above 15 centimeter is the colon, the sigmoid colon. So the location becomes really important because for rectal cancer, one of the treatment strategies is radiation therapy for local control. But for colon cancer, we don't use radiation therapy.
It would be a different treatment, so it's important to know.
So bottom to about 15 centimeter, and the rectum is divided into low, mid, and upper, 3 areas. And the location is also important because low rectal tumors have a different outcome. They're more aggressive, and in terms of surgery, they may need a permanent ostomy bag. When it's really low, where they cannot really hook up the remainder of the rectum. So location becomes important.
And what's the prevalence?
That's a great question. I was looking at the data yesterday in anticipation that this may be a question. In the US, is about 150,000 new cases per year. And I think the rectal cancer has overtaken colon cancer. More new rectal cancer, about 50 to 60,000 per year. And the rates of new rectal cancer is going up in rectal as opposed to colon. And also more in younger patients than older patients.
Okay, so I saw actually something on that, I think it was on 60 Minutes maybe, talking about it with the younger patients. So why do we think that is?
Well, I think it's complex. When you look at the genetic factor, it's only about 10-15% at the most. But majority of it is, lack of exercise, obesity, and really unhealthy food habits, unhealthy processed foods. Even the World Health Organization now classifies red meat as a risk factor. Right, WHO says red meat is a risk factor for colorectal cancer, and I personally don't eat red meat. I try, I like to eat lamb here and there, but I try not to overdo it. And I tell my patients not to, grill the meat. I think there may be some carcinogens released when you grill the meat. So it may be relevant to folks who live here, where meat is a big part of their diet, I understand. So I think switching over to fruits and vegetables and, and exercise and controlling body weight is really important.
So major lifestyle factors in this case. Is there any type of regular screening that people should get, or what do people need to be aware of?
So everybody should start, the US national guidelines allows people to get a colonoscopy at 45 now. At 45,
okay, it used to be 50, right?
So they moved it to 45. Some insurance, I think they give a pushback, but I think doing colonoscopy at 45 is not unreasonable. And if you have a family history, you can even start as early as 40, if you have a family history. Let's say somebody has a colon cancer diagnosed at 51, their family members can get screened at early 40s. And then if you have syndromes like Lynch syndrome, it's a genetic syndrome. If the families test positive for it, you can even start screening at the age of 21. That's the national guidelines. So there's a lot of importance towards screening in this disease.
Okay, so 45 then for screening. When you talk about family history, if say you have a close family member who maybe hasn't had a cancer diagnosis but have had maybe multiple polyps have had to be removed, is there a chance that you might?
No, I think it's really complex. As I said, the risk of genetic predisposition is not high. It's about 10%, 10-15%. 85% of the colorectal cancer in the US, and probably here is all sporadic, meaning environmental.
Okay. And what are the outcomes now in terms of treatment and?
Yes, generally speaking, the outcomes for all cancers have improved when you look at the national database, and outcomes for colorectal also is improving. But I think the key is prevention. We are not doing enough to prevent this in the first place. We were talking earlier about HPV in anal cancer and oral cancer, but there's no prevention in here. I think prevention is lifestyle change, and that may take 20 years to see.
Okay. Thank you so much for sharing this information with us. I think, the big message here is really
Right.
look at what you're doing, look at what you're eating.
Look at what you're eating, exercise, obesity control, and really can go wrong with fruits and vegetables. And I'm a big proponent of organic foods.
Okay.
If there is available, buy organic. I think pesticides, water, they may all play a role in this. These are all unanswered questions.
And if it's in a box, maybe don't eat it.
Exactly, right. I think processed foods, even simple things like cheese is heavily processed. Even ice cream is heavily processed.
Okay.
They're all ultra processed foods.
Okay.
If you Google ultra processed foods, you may get a list of things you may want to avoid.
And those are the things.
You can't avoid all of it, but I think it's important to pay attention to these things.
And if you are having those things, moderation.
Moderation,
right?
exactly.
Okay.
Yeah, absolutely. You may still get it, but at least you've given yourself a chance.
Okay. All right. Dr. Nagarajan, thank you so much for joining us.
Thank you.